Hi, my name is Shakira. Today I'll be doing an abdominal assessment, and I'm the student nurse today. Can you tell me your name and date of birth? Now I'm going to assess your level of consciousness and mood. Can you tell me where you are? Can you tell me what's today? Can you tell me who's the president? Patient is alert and oriented ×3. Mood is pleasant. On a scale 0 to 10, 0 being no pain, 10 being the highest pain, what is your pain level? No pain noted. Do you use any mobility aids such as walkers, canes, crutches, or wheelchairs? Do you use any medical equipment such as IVs, O2s, ostomies, dressings, subcranial devices, or specialized mattress? No medical equipment or mobility aids noted. Now I will state the vitals. Blood pressure is 90/60 to 120/80. Temperature is 96.8 to 100.4. Respiratory rate is 12 to 20 breaths per minute. Pulse is 60 to 100 beats per minute, and pulse oximetry is 95 to 100%. Now I would inspect the contour of the abdomen from 2 different angles. So I will start on this angle. I'm going to start on this angle. So abdomen is flat and symmetrical on both left and right side of the quadrants. No distension noted. Now I would inspect this skin. Now I would inspect the abdomen, excuse me, for any colors, hair distribution, veins, lesions, scars, and umbilicus. Color is normal for ethnicity. No hair distribution, no colors, veins, lesions, scars. Umbilicus is midline and inverted. Now I will auscultate using the diaphragm of my stethoscope for vowel sounds. I will start at the right quadrant, which is the most active because of the ileocecal valve. This is the diaphragm of the stethoscope, and I'm starting at the right quadrant. Vowel sounds are active. Vowel sounds could either be hyperactive, which is fast moving, hypoactive, which is slow moving, or absence. If there is an absence, I will listen to each quadrant for 5 minutes and a total of 20 minutes. Now I will auscultate using the bell of my stethoscope at the abdominal aorta, and I'm listening for bruits, and bruits is a turbulent blood flow. I will start at the xiphoid process down to the pubic symphysis, just 2 inches above the umbilicus. So I'm using the bell and my stethoscope. I'm starting at the xiphoid process. Now I will percuss all 4 quadrants. As I'm percussing, I'm listening for, as I'm percussing, I'm checking for Tiffany. And Tiffany is a hollow drum-like sound. And I would start at the right quadrant. No Tiffany noted. If there was Tiffany, it would be a dull sound, and that means it's a sign of mass blockage or enlarged organ. Now I would inspect the abdomen for any hernias or inguinal canal. And I would have the patient sit up like they're doing a crunch, or bear down like they're making a bowel movement. No hernias noted in the umbilicus and inguinal canal and ring. Now I will palpate each quadrant, starting at the right quadrant for any tenderness or masses. So I will palpate using a circular motion. No tenderness or masses noted. If there were any tenderness, I would check for rebound tenderness. And lastly, I would check for costovertebral angle tenderness, and that would be me standing behind the patient and doing this at their lower right back. And that is my abdominal assessment. I believe for, I'm not sure, when I auscultate using the bell of my stethoscope, if I said no bruits noted at the end. If I didn't, I meant to say no bruits noted. Thank you for watching this video.